Hi, my name is Parisa Charmchi-Goodwin, and I am the Executive Director of the Commission on Racial Equity in Public Health. Healthcare policy shapes lives every day. Recently, the federal government made significant changes to Medicaid and Access Health that will affect families, providers, and communities across Connecticut. These are the biggest changes to our healthcare system since the Affordable Care Act. Over 100,000 Connecticut residents are projected to lose their health coverage in the coming years, starting in the next few months. Many people think these changes will only impact a small group, but coverage losses strain the whole system. Here's how.
Hi, I'm Dr. Brittany Liebla. I'm a doctor of nursing practice, an addiction medicine specialist, and senior APRN with CHR. When my patients lose healthcare insurance, they don't just lose access to care, they lose hope. They lose sight in a normal future and regaining their life back. I don't typically talk about why I got into addiction medicine to begin with. When I was 23, my brother died of an opioid overdose, and I threw myself into addiction medicine treatment. But the reason I stay is because of my patients. I get to bear witness to their near impossible self-reinventions every single day, made possible because of healthcare insurance. Recovery happens because of healthcare insurance. We have to look at community health as a whole. And we know that patients of lower socioeconomic status bear the burden of worse health outcomes. That is beyond politics. That is basic community health care. So you don't want to lose addiction treatment in your community. The consequences are vast. And the reality is that translates to community health centers and nonprofits not being able to deliver that care.
Hi, my name is Namfi Lubogo, Co-Executive Director from PathCT. The families that we serve rely on Medicaid services. They already have a difficult time navigating all the state systems, all the state services, and so cuts in Medicaid would be just one more hurdle that they have to face. Without help from community-based organizations like ours, these families would fall through the cracks. It would lead to loss of income and added stress. And so we want to make sure that Medicaid is restored for the families that we serve, but also for community-based organizations like ours who have community health workers.
Hi, my name is Aisha Clark, and I am the Executive Director for Health Equity Solutions and the co-chair of the Commission on Racial Equity and Public Health. So the federal changes are really going to have an impact in our state of Connecticut. It's important for our lawmakers and administration to really listen to those with lived experiences so that they will be able to ensure that we will keep individuals covered. Those who are marginalized, especially our Black and Brown communities, and those who are in low income will bear the burden of these administrative barriers. The changes are intentionally convoluted and they are rolling out quickly. And it's not leaving time for those who are enrolled to stay enrolled. And there is no way for them to learn about the administrative traps that are happening for them to stay enrolled. There is no exaggeration. People will die with these changes. So we need to respond quickly with laws, processes, and oversight that will keep people covered, sustain our health system, and listen to people with lived experiences. Let's be clear, without Medicaid, also known as Husky, many people will lose care. Providers will struggle with less revenue. And if providers go under financial strain, where will people go? It's important for us to do something now.
The cuts will impact every one of our 169 towns. It will hurt our clinics, hospitals, and community providers. The first step is understanding the impact.
Hi, my name is Dr. Alvey. I'm board certified in family medicine. I take care of sick patients in the hospital here in the greater Hartford area. Preventative care is one of the most crucial aspects to any healthcare system. In the absence of preventative care, or for an individual's ability to seek preventative care, we end up with a sicker population. It is much more taxing and expensive to take care of sick people. The cost of acute care hospitalizations far outweighs the cost of preventative care.
Hi, my name is Barry Simon. I'm the president and CEO at Oak Hill, Easter Seals Oak Hill. Here in Connecticut, I am highly concerned about what's happening with Medicaid. When funding instability collides with an industry that's already on shaky grounds, and you're dealing with a staffing crisis that has been going on for decades, you get into a concern about access for care. The individuals that we serve have struggled for a long time to be able to get access to care. The people who provide the services have been working for decades and are highly dedicated to providing that care. And when our business is on shaky grounds and we're getting unstable funding, it creates a challenge for our ability to provide those services.
Hi, my name is Mark Schaefer. I'm the Vice President of System Innovation and Financing for the Connecticut Hospital Association. So when individuals lose coverage, there's an impact on the individual who loses coverage. There's also an impact on hospitals, and there's an impact on the broader community. When somebody loses their insurance coverage, they often avoid or delay seeking care. What that means is they may put off getting preventive services or early care for conditions that might otherwise be manageable. They might not get a doctor's visit or even fill their prescriptions because of the cost. And as a result, manageable conditions like hypertension and diabetes and infections can become much more serious and more difficult to treat. And at that point, many patients go to the emergency department of their local hospital because it's the one place they know they can go for care and not be turned away because they don't have the ability to pay. There's also implications then for the hospitals, because the hospitals are providing care for which they are not going to get reimbursed, and we call that uncompensated care. And when hospitals are providing significantly more uncompensated care, it creates enormous strain for the hospital, and that can result in their pulling back or reducing essential services that they would otherwise use to invest in technology and advancements in medical care. And that has implications for the broader community. So when hospitals are not appropriately utilized, when they're financially strained, when resources are limited, everybody, whether insured or uninsured, can be affected by less access to care.
Connecticut needs to make a plan to stop the coverage crisis.
Connecticut needs to make a plan
Connecticut needs to make a plan to stop the coverage crisis
to stop the coverage crisis for our communities.
for the people that we serve.
For our patients.
For patients and their communities.
For families.
For all of us.